As a program officer, I kind of manage, support and monitor grants in AP, Karnataka, Manipur and Nagaland right now. To be very honest, this is a program which was conceptualized by our grantee or our partner HLF PPT. Our focus as a donor or a funder is to kind of think long term and partner strategically with the government, and through partners like HLF PPT and many others in the 6 highest prevalent states in India, our focus in the first 10 years was to have a model in place where we are able to work with the most affected communities, the most vulnerable communities in very specific geographies. And the main focus was to reduce HIV prevalence in these 6 states. But somewhere down the line we realized that unless we take the community along and make the entire process community-led, genuinely community-led, the program is not sustainable. The funding stops, the program ends. Right? So even though the government has a very strong implementation focus, getting the communities to own the process was very important. So like I mentioned earlier that we have created very strong community structures, informal groups, networks, formal registered community-based organizations which actually run programs now. Through these CBOs, other than focusing on HIV prevention implementation, over the course of the 10 years, they have realized that unless you address the unmet social needs, which includes focusing on the needs of the children of the sex workers, you're not addressing the entire problem. So for a very simple example is that if you talk to any sex worker in our program, she will tell you, at least 9 out of 10 of the women will tell you that they don't want their daughters to get into sex work, right? So that is a very positive, heartening kind of a development. And second is that, unless we create awareness in the general public about the difficulties faced by the vulnerable communities, we are not addressing the issue of stigma and discrimination. So things are changing for the better. I think earlier the kind of issues these communities would face when they went to a government health facility, or even accessing any kind of a social entitlement that they are legitimately allowed to access, they used to face a lot of stigma and discrimination. I'm not saying that it has gone away completely, but it has come down significantly, which is why doing programs like this, Friends Forever, is very, very important, because one is to look at addressing the adult population, but the entire belief that HLF PPT came to us with was that why not the children, because in terms of a long-term kind of awareness building, unless you work with the children, again it will not sustain. So take the example of any family. Today children are so sharp, they are so well aware thanks to the internet and television, etc., that they are almost like parents to their parents, right? So they are much more open-minded, they are broad-minded, they have a strong point of view, they are socially conscious, right? Which is why we thought, building awareness among the children is a very short way of ensuring that, all this education, knowledge, awareness building is internalized, because kids absorb it very well. And down the line, you may not see the impact immediately. What we are trying to do through brand ambassadors like VVS Lakshman, it will take time. Maybe in the next 3 years, in the 5 years is when you'll actually start seeing impact, but it's an investment worth making. So which is why we are kind of saying yes and supporting our partner like HLF PPT. See, again, it's not in the ambit of what we do as a foundation or what HLF PPT does. See, that's where, the role of the community-based organization becomes very, very important. See, earlier, whether it's a government-run program or a donor-funded program, through an NGO, when you try to kind of counsel and try to build confidence, it makes a difference, but at a very superficial level. But the minute you start, involving the community, where somebody from the community, a sex worker herself, becomes a peer educator, right? And the CBO has formal committees, right? So you have a committee which looks at services like, condom services, or treatment, health-seeking services like STI services. Then you have advocacy committees which are entirely run by the community. So the change that we are seeing is that, once the community leaders, there are a lot of leaders in the audience today, they take on the responsibility of counseling. So even before counseling, the first step is to know what the issues are, right? So as a donor or as a government or even an NGO, you're very well-meaning, right? Your intent is very good, but you're not able to get down to the day-to-day issues that faces a sex worker. Whereas a CBO leader, because she herself is a sex worker, she knows the pulse of the community. So the first step is to know the pulse, right? Second step is to identify what is the issue. Is it a violence issue? Is it something to do with, not being able to save the money that a sex worker earns? Or is it as fundamental as, if I'm a HIV positive sex worker, how do I disclose my status? Right? How do I access treatment? Will I be able to continue living? There are so many doubts in the mind of a HIV infected person that, he or she feels comfortable talking to a fellow community person. Then counseling comes at a much later stage, and by now I think we have good systems in place where issues are identified proactively. The community themselves, take on the responsibility of counseling. So I don't know whether I've answered your question. One is having formal counseling systems from a health standpoint that the government already has, right? So if you walk into a HIV testing, what we call as ICTC center, you have a formal counseling, pre-counseling, post-counseling, after testing also, right? But those are on the prevention and the treatment side. Whereas a lot of counseling that needs to be done on a day-to-day basis that a sex worker faces, the CBOs are taking on that responsibility increasingly. See, again, may not be through our program specifically, but again, if you look at what the National AIDS Control Program is trying to do, at the national level you have NACO, and again at a state level you have the state's AIDS control societies. I think the government has done a very good job in terms of building awareness as far as general public is concerned. So in the last couple of years, you would have seen a lot of these what we call as IEC campaigns, whether it is print media or television media or many other forms of media, it has really stepped up. So people no longer feel shy talking about, sexually transmitted infections. They know that they can walk into a government hospital and get an STI treated, right? And people are no longer afraid saying that, should I get myself tested for HIV? It has become a part of the system now. So even as a normal person, if I go for my annual medical checkup, HIV test it has become a part of, what needs to be done. So to answer your question, I don't think our program does that in a very direct way, but we support the government, right? And indirectly through the communities we work with, the NGOs and CBOs, they take on a lot of responsibility of earning the respect of the general public, saying that, it could be you and me, right? Nobody comes written on the forehead saying that I'm a sex worker or I'm an MSM or an IDU. It could be anybody sitting in this room. But you earn respect for yourself as a community when you start delivering on the prevention agenda, which I think, at least I would like to believe that, our communities have earned that credibility. So one is for the government to build awareness directly, but our communities and our programs build awareness in a more indirect fashion, but equally impactful.